information about cardiac conditions to schools, licensed childcare facilities, and agencies providing respite. It is based on the standard material produced by the Unified Referral and Intake System. The heart is a strong muscle that pumps blood to the lungs and body. This occurs through a sequence of organized contractions of its four chambers by the discharge of electrical signals. The heart collects oxygen-poor blood from the body, which is pumped to the lungs to get oxygen. This oxygen-rich blood is then returned to the heart, and the heart pumps it out to the body. A congenital heart defect happens when the heart or the blood vessels near the heart do not develop normally before birth. As a result, blood flow may be slowed down or blocked in the heart or in the vessels near the heart. Other congenital heart defects can cause blood to flow through the heart in an abnormal way, which causes it to have to work harder. Stenosis is a narrowing or obstruction in heart valves, arteries, or veins. Septal defects are an opening between the left and right chambers of the heart, commonly referred to as a hole in the heart. In most cases, septal defects close naturally or are repaired early in the child's life. With more complex conditions, blood pumped to the body contains less than normal amounts of oxygen. This can result in cyanosis, which is a blue discoloration of the skin. Arrhythmias are abnormal heart rates. They may be completely harmless or life-threatening. Bradycardia is a heart rate that is too slow to meet the body's needs. Tachycardia is a fast heart rate, usually more than 220 beats per minute. Rhythm disturbances affect the electrical signals that produce the organized sequence of heart muscle contractions in its four chambers. These electrical signals may be affected in different ways, such as causing a delay, a longer interval between signals, or a signal occurring too early. Treatments for cardiac conditions may include medication, surgery, including heart transplant, or implantation of a pacemaker or internal defibrillator. The nurse will provide additional information if a child in your care has a pacemaker, internal defibrillator, or has had a heart transplant. Most children with cardiac conditions can participate in physical activities without restrictions. However, some children may not be able to participate in competitive sports where there is strenuous training and prolonged physical exertion. If a child has restrictions, they will be included in their healthcare plan. Consult with the child's parent if you are uncertain about their participation in a specific activity. Infective endocarditis is an infection caused by bacteria that enters the bloodstream and can affect the heart lining, valves, or blood vessels. Some medical and dental procedures can increase the chance of infective endocarditis because the procedure may cause bleeding, which allows bacteria to enter the blood. If a child with a cardiac condition is being transported to the hospital for any reason, ensure that medical personnel are aware of their cardiac condition, so procedures can be implemented to prevent infective endocarditis if required. Congestive heart failure occurs when the heart is unable to pump an adequate amount of blood to meet the body's needs. It does not mean that the heart has stopped working. Congestive heart failure can take several days or weeks to develop. However, congenital heart defects and arrhythmias can cause congestive heart failure. Signs of congestive heart failure include sweating during quiet time, persistently rapid or labored breathing, shortness of breath, fast or irregular heart rate, chest pain, nasal flaring, blueness on or around the mouth, eyes, ears, or fingertips, listlessness, cannot stop coughing, skin becoming increasingly pale or blue, and suddenly tired. Signs of congestive heart failure are more noticeable when children are exercising or actively playing. When a child is experiencing signs of congestive heart failure, have them rest. If symptoms do not improve with rest, contact their parent. If symptoms do not improve and you are unable to reach the parent within 5 to 10 minutes, call 911. Place the child on the floor in recovery position. Keep their airway open. Loosen any tight restrictive clothing around the neck if necessary. Stay with the child until medical personnel arrive and inform them that the child has a cardiac condition. If the child has noisy gurgled breathing, which may be caused by fluid buildup in the lungs, call 911 immediately. The nurse will provide additional information, if necessary, on specific needs of children in your care. Instructions on how to respond to the child's cardiac condition is also included in their healthcare plan. If you do not know which children in your care have a cardiac condition or how to access their healthcare plan, talk to your administrator.